Welcome to MYBcast, a podcast series devoted to exploring alternatives for self-care through somatic touch therapies of all sorts. We are fascinated with the mind-body connection, and so are the people we talk with. Today, we're continuing our series, Portraits of the Pioneers. Portraits offers an in-depth look at those who have been actively involved in the exploration, development, and practice of somatic touch therapy since its early inception. I'm Anna Marie Bowers, and I'm here with my co-host, Richard Mack. Good morning, Richard.
Good morning, Anna Marie.
Today, we are thrilled to be joined by our guest, Mark Hoch, MD, a founding diplomat of the American Board of Integrative and Holistic Medicine. Mark has an active medical practice, holistic integrative family medical practice in Asheville, North Carolina. Welcome, Mark.
Yeah, great to be here with you. Good morning.
We'd like to start today just with a little bit getting to know you, your story, what got you interested in somatic touch therapies in the first place, and anything that you would like the audience to know about you that I did not mention in my very brief introduction.
Mark, are you there? Mark, are you freezing?
Yeah, hello. I'm here. Can you
Yes.
um
So just
yeah,
a little bit about your story.
yeah, I've always been an active person and just been outdoors, been kind of embodied life, being outdoors, sports, riding motorcycles, martial arts, things like that. And then when I was in medical school, I was at a medical student conference and I met Rita Lustgarten, who was a Trager practitioner. I had a session with her, and it was, that's sort of what got me on this journey of integrating the somatic part into, my medical practice, or which at that point hadn't even started yet. And it was just a profound, experience, just really dropping in and feeling very integrated in my body and just everything else just like melting away. And I would say that was really the beginning of it.
And how long ago was that?
That was probably around 1986-ish, in there, 85. And then I just started, just trying to get involved, find out more about Traeger. I wound up doing some of the trainings. The first one I did for the beginning training was with Sheila Merle Johnson at her place, in the San Francisco Bay Area. And that was, also a profound experience, and just also being with people from all over the world that had come over there. So Traeger, the work that Milton Traeger developed was sort of my entry. And I just ran with it. I remember even when I was a resident, we had to do a grand rounds, as part of our training for, the entire department of family medicine, which included not only all the residents, but all the community faculty and people at the hospital. And so I did my grand rounds on Traeger and Traeger's work, and I weaved in stories from how I'd worked with clients, including at the Family Medicine Center, and all the things that Milton had done. And it was fun because it was really well received. And that's sort of my beginning. And then tell me where you want to go from here.
How did that impact your lifestyle? Traeger is a very active somatic practice, so it involves a lot of movement. Well, sometimes a lot, sometimes a little.
Yeah.
But it is a movement-based touch therapy. So did it impact you in your life, the receiving of the work, the training, the work with clients? How did it impact you?
Yeah, I mean, I think the personal thing is foremost. It was just, again, a profound experience of not only just being in my body, because I was already pretty good at that, but the everything being integrated. Every part of the hand and the arm and the shoulder and the back. Just everything flowing, and then playing with what Milton called the mentastics, or mental gymnastics. Exercises. When you weren't getting the benefit of being on the table with somebody else helping you, with the experience. And, I found that to be very helpful personally, and then also with my clients, because a lot of people had problems with pain. And it sort of led me down this road very heavily into a musculoskeletal based, practice. I do full spectrum family medicine still. I don't do like regular primary care so much because and I'll get into that later, that how I'm focused much more on healing than fighting diseases, which our system unfortunately is focused on. But it just led me down that road to other explorations, and I become very heavily involved with osteopathic medicine, um, and that's between all the somatic practices, that's at least half of what I do every day in my office for many years, and helps people with all kinds of problems, which we can get into, and then also professionally. I spent some time when I was in Minneapolis working at the Sister Kenny Rehabilitation Institute, which is part of like that and probably Mayo Clinic are the two best hospitals or biggest hospitals in the entire state of Minnesota. And they had an amazing 3-week program for people with chronic pain. And it was mostly focused on life skills, how to live with it's how to live with chronic pain, but how to manage it with things other than opiate medications. And that, so I was able to bring that a little bit into the work there, and also, when I would see people in the hospital, I would do things with them too, and yeah, it's been a great journey, profound benefit to the people I see, and it just gets them connected, with themselves and with what's going on for them.
Mark, so looking through your CV, I'm just absolutely amazed at the different studies that you have taken on. I would truly consider you a renaissance man of the new medicine coming forward for sure. I'd like to start a little bit about cognition, the cognition and the integration aspect, and Sylvan Tompkins, who is an amazing, amazing thing. There's a beautiful little clip on YouTube about him talking about the skin, it's where it's at, and that as a receptor, knowing that the soft tissue of the human body is a way that we're receiving the movement patterns and the things that are driving us in our own possible healing opportunities. Tell us a little bit how you got involved with him and how that kind of brought you down your path.
With Sylvan's work.
Yeah.
Yeah, so with Sylvan Tompkins, I'm familiar with his work through uh, Gary David. I don't know. He's out in Sherman Oaks, California. There's a somatic tie-in here. So my first wife, Kathy Jennings, who I want to weave her into the story, and some of the things that happened also pulled me into all this. She was also not only a trigger practitioner and a tutor, but also studied with Emily Conrad and continuum movement. And Emily and Gary were together. So then Kathy got connected with Gary, and then we got into this whole exploration of affect psychology, with Sylvan Tompkins' work. And I was in a bunch of classes with Gary. I'm still, really close with him. And so that's how I got in with Sylvan's work. And I think that's all really important, because all of these parts of our being are so important to our functioning. And I I think what's so important is for us to be aware of that and have these experiences, or afford people the opportunity to have these experiences, to tap into the feeling state, including in the tissue. What's going on in your skin, what's going on in your muscles, what's your not only emotional state, but affects are probably a little beyond the conversation here, but that's a little bit different, because they're transient states that just help us pay attention to what's going on in the moment and what our experience is, which we can also do through our physical sensing in our body.
How do you work with clients to teach them to pay attention to those things? Like, where do you start with somebody who has no experience really paying attention to their own somatics? their own state of being.
Yeah, some of it is just, you know, you can ask the question, how's that feel in your body, or what's your experience? Because people are so often focused outside and not inside. So it's turning the conversation, the awareness inward. I think that's a great starting point, no matter where anybody is. And then when I get to the exam part or the treatment part of my visits with folks, I'm bringing in things that they have said or what's going on in their life or what their issues are to the table. And you know, whatever that is, could be a painful thing or movements they're into, or even when you're working with an organ, you know, one of the things that's really up right now, everyone seems to have problems with like this liver, spleen, stomach balance from a Chinese medicine perspective. But when you put your hand on their liver, and part of the, you know, the part of the liver that's connected to the other organs is completely disorganized, not moving appropriately, and you point that out to people, and then a little bit how sometimes they're over analytical mind, overthinking things. It's like different than anxiety, and it helps to point that out to them, you know. And then what happens is it disturbs this whole thing, and then, you know, everything's going backwards, and, you know, because everything's coming up to their head, even the acid in their stomach is coming up to their head, and they can make that connection because they've already experienced part of that, and that's why they're coming in. They're like, you know, I can't deal with this, and then when you can see their personality type talking to them, and then point that out in a gentle way, or ask them how, you know, is this the way you run, you know, on a daily basis? And then they make the aha, and then it just goes from there. So I find bringing things, you know, very directly into what their experience and what their concerns are is the key to opening that.
That's awesome. So it starts usually with attention to the body and then bringing in the other pieces, hence the body mind connection kind of piece there. Yeah, exactly. So do you want to talk a little bit about, you said you wanted to weave Kathy into the story somehow. If you would like to do that, Kathy Jennings.
Yeah, because I forgot where I was in my Traeger training. I was probably somewhere around intermediate training, and I was I was in Connecticut at that time, probably at the end of my residency, beginning practice, and then I just was invited to this dinner that, that Kathy had at her house, and it was all these Traeger people from New England were over there, and it was really fun because we were just playing around with like mini trades even before that was the appetizer, before we had the meal, um, and you know developed some great friendships out of that. And then probably within about a year after that we got married. It was
Oh, awesome.
um, and then we did quite a bit of things together, revolving around Traeger's work, and we were able to go out to California, and to the international conference, probably the last one that Milton did, and also be at I think it was the next to last training that Milton did, um, and I know this might be slightly off track, but not really. What impressed me about Milton, and I think this is important for people to hear this. When when we were at that conference, that people came from all over the world. It was like 300. You both of you might have been there, but it's like 300 people from all over the world, and everyone is like so excited to be there and so excited to see each other and be able to talk to people about what's so fun for them, but like most people have no idea what's going related to it. And there was so much buzz and excitement and noise and all over the place in the room. And then Milton just walks in the room, and probably most of the people didn't even know he was there, and it was instantly silent. And it was like the exact opposite of dropping a pebble in a quiet pond. It was like all the waves are there, and then he comes in and it's just instant peace everywhere. And I remember Emily saying to Milton, get everybody in hookup. And he just looked at her. He said, Emily, they're already in hookup. It's like, so that was my first experience of Milton in person. I'd spoken to him on the phone before that, but I hadn't met him. And, and it was just his ability, not only that he carried that, but he was able to bring it into the space so everyone else could feel it, and it was very profound. And then the second time, he was probably just about 88. He had a couple strokes, he had Parkinson's, and he was having trouble getting around. He was actually in a wheelchair. And I remember his personal attendant, Jose, and I lifted him out of his chair to put him on the massage table, or the treatment table. And when you were on the table with his hands, you couldn't, even as a doctor, I wasn't really aware of any of his physical limitations. You were just like a cloud in the sky, and he was fluffing you up.
And I also share an experience of what it's like to be on the table and feel his work on your body. And so I'm going to invite you to go back and revisit that experience when he's incapacitated to some extent himself from stroke and different physical problems that he has. And people are, I think you mentioned you actually helped lift him out of the wheelchair onto the massage table to be able to work on you. And so let's just revisit that scene again.
Sure, yeah. I think it was the second to last conference of or public thing that Milton did, in with the work. And his assistant Jose and I literally had to grab him under the armpits and we lifted him up onto the table. And he's like 88 at this point. And even with some debility from a couple of strokes that he had and some Parkinson's that he had, when when I was on the table, my experience was just like being a cloud. He's just fluffing you up, like not even like a pillow, because it was that soft and beautiful. And as a person who is medically trained, and I know what happens when people have Parkinson's, stiffness, and it was absent. He just transmitted the feeling and the movement through his being, and it didn't matter what the physical, you know, limitations were. They didn't interfere, at all with the experience. Also very profound.
I'm wondering how much that is tied in with the whole remembering what it feels like to move. If you can remember what it feels like to move, that whole mind body connection, again, we're talking about the self care and the hookup and I don't know. Do you have that kind of experience yourself where if there's a physical limitation, you can still remember what it was like when there wasn't that, and you can still um, have that same presence with the client? That's kind of a convoluted question, but I think you kind of know what I'm talking about. Yeah.
Oh yeah. No, that's a great question, Anna Marie. And I love the term remember, because what it means is like the members of a community, the members of your body, it's the parts, and it's remembering, it's putting it all back together into the congregation, into the unity, the experience. And to me, that's really the essence of healing. And what opens the door to healing is when we are connected to our essence and to that essential wholeness in our being. And Dr. Still, who was the first osteopath, he called it the breath of life. I've done a lot of work in the Sufi community, and the term we have for it there is fitra, which means your essential nature. And to me, that's what the work's about. And when I'm working with a client, and they're on the table, whether it's the movement like that Milton did, or it's tuning into the movement of the organs, or the primary respiration, which really comes from the brain. So that's the first movement in our physical body when we're in the womb. And when we focus on that and then help the person experience that, and I'm very clear when I'm working with them, is like, we're going to go into that and we're going to see what your life force, your vitality, what it is trying to do to get you back, into your health. and we're going to follow that. And I'll help that process, but I'm not doing that, you know. And people, they usually get it, and it's pretty cool, and that just really opens the door to the healing.
Yeah.
So great question.
So it would be fair to say that your whole path towards the mind, body, spirit connection really started with your connection in the Traeger community. And then from that, you went in with your medical training and you went deeper down a path, taking in that information about what it is to be connected at the subconscious level with your clients. Would that be fair to say that from that point, you were really looking at healing medicine from the perspective of connecting at that subconscious level with the clients that or the patients that you're dealing with?
Yeah, I think that that's fair to say. And you know what I try to tell folks too, like, you know, when I was in medical school, I don't know, first probably by the end of the first year, I was like, where's the health? It's like we were actually quite well trained in the science, and back in that day, you know, I think there still was genuine care for people that was taught, which I'm not sure is there now, but yeah, that does hit the nail on the head, Richard.
Mm, interesting, interesting. So you left the conference and you went on your path, your journey. You've got a number of different things. You mentioned Sufi. You mentioned, um, you haven't really mentioned yet the Qigong aspect of it, but the whole inner energy of the 5,000 years of Chinese medicine in the connection of the meridians and the energy flow through the body. Talk to us about that, Mark.
Okay, about the Chinese medicine piece and the Qigong. Yeah. So my, you know, journey into Chinese medicine came through the martial arts, and part of it was kind of interesting. I just with medical school and residency, I just couldn't get, you know, to the training of the more of the outer arts. So I kept getting more into the Tai Chi and the Qigong, because I could get to those classes and we had a really good teacher nearby. Um, and then I just started, yeah, studying with several different Qigong masters. Um, Sometimes, you know, prolonged periods or just do one workshop or read a couple of their books. And again, similar idea, you know, you're connecting with yourself, and that, you know, and you're also connecting with the earth and the sky and the, you know, the cosmos are ways of working with that, and being consciously aware of moving the life force and the energy through the body, and then also noticing when things are out of balance in other people. And you know, I think the other gift, you know, from my experience with Traeger was I had and the osteopathy, I had no idea how kinesthetically I was aware. Um, and it, you know, it's just like one of those skills where, you know, you have and just, I just didn't even realize it. And, you know, and one of the ways that that came out, and then I can get back into the Qigong, was when I did my cranial osteopathic training, every single one of the instructors said to me before that because it was an intense class, 40-hour class, then we had a written exam, practical exam, and then you had to treat somebody so they knew that you know what you were doing. So all four instructors independently came up to me and said, do not feel bad when you fail this part of the test. Your system is so screwed up because I had a lot of injuries. You will not be able to feel it. It's not your fault, so don't feel bad about that.
I
Wow.
love it.
And even with that quadruple nocebo effect, I got 100% on that part of the thing, and I got my certificate. You know, and you know, and it just really, it was an aha moment too. Like, oh, this is just how I roll, and I just had no idea. You know, that was such a big part of who I am and what I'm going to be doing. You know, that was another um, big aha moment.
Is it kind of a case where your injuries and your ability to really be in touch with yourself, your own body, your own physical, with all of your activity, and then adding injuries, giving you more attention, really expanded your awareness of what's possible?
Yeah, I think that's true, you know, and going on the healing journey, because then you start, you know, I probably explored some of these things a little bit more than I might have. And yeah, and then, it's just you find the keys that start unlocking doors, for my own journey, but then it helps me to pass those keys on to the next person, whether
Yeah.
it's a student or a client. Yeah.
I'm really intrigued by how it was received by fellow medical students. All of this, your more global concept of health and healing.
In my training program, which was at the University of Connecticut, it was pretty well received. And that's one of the reasons why I chose that program. It was a good program, but I knew they were open to that. And William Miller, who was the residency director at the time, was open to that. And we actually had a thing we would do it maybe every quarter, go to his house for lunch, and he called it Edge Walkers, and we'd all bring our experiences. So some of the faculty were very open. The My fellow residents were open just because I had a really good relationship with them. It wasn't so much that they super resonated with it. Some of them did, but some of them, it was a little bit strange, but they respected it because we had, respect for each other.
Sure,
Yeah.
sure. That's great. Anything else during those medical school? Like it sounds to me like what you're discovering is the things that are in common with all of these different modalities, professions, therapies, whatever you want to call them, that there are some things that interplay with each other and build on each other, and there are some things that are in common across these different modalities. And this is one of the things that has intrigued Richard and I in doing these series too, which is why we are looking at all of these different kinds of modalities and treatment plans and see how they interact with each other. So maybe just a little bit about what your experience is along those lines.
Yeah, that's a great intro also. Yeah, I find I'm usually looking for the commonality and with different systems, and also just really focusing on the truth, or I'd use the word what's real with a capital R, what's really happening, not what we think or want, or because I think so many people get caught up, even in a discussion, they're coming in with an agenda, which is not necessarily in the highest, and then it just hijacks the entire process. And I just find that people just get lost, and it's really harmful. So yeah, for me, it's looking for, how are these systems or these ideas or these people, how are they connecting, with what's really going on? What's their language? Because sometimes the language, you can get caught up in that because it's very different language, but they actually are pretty much saying the same thing,
Mhm,
but it's
mhm.
because of the culture or the way the language is structured in Chinese or English or whatever, there's not always a one-to-one word. But I find if we're looking for what's, the truth and what's where the health is, and and focusing on that as to bring us back to balance and harmony and health and connection and unity, that just always seems to work. And when we get caught up in ideologies and this and that, or trying to dominate somebody, it almost never works. I mean, it might be a little different if, somebody breaks into your house at 3 o'clock in the morning and they're stealing your stuff. Yeah, you might want to get in their face and throw them out. That's a good idea. But generally, it's not a good way to roll.
Makes a lot of sense. That makes a lot of sense.
This is fascinating. I'm just sitting back and listening to you open up here, Mark. And again, your journey about following energy and a genuine desire to help people heal themselves, coming from a place that is coming with inside you. Dean Juhan, who was one of our teachers and also a person we've had on the interview, loves to talk about the human body as an aqua system of just energy and fluids flowing through. And the idea of just basically going in there and helping the person who's dealing with the issue, releasing those blockages and opening them up. I'm feeling that from you.
Yeah, and I know Dean, pretty well. And we had him come out and do at least one workshop in Minneapolis, Kathy and I were sponsoring things. Yeah, and yeah, I think same idea, might be expressed in slightly different words. What Dean's talking about, I totally resonate with that.
Yeah. So I've heard you say healing a couple of times, and sometimes that's a word that has multiple meanings for a lot of people. I'm just kind of curious if you were pressed to put a definition on healing.
Ooh, that's a big one.
Because it has to do with what you're saying, what's really going on and what people think is going on. And so there's an interplay there between and some people, when they hear healing, they immediately think, oh, I will have no more physical pain. And some people, when they hear healing, they think, oh, this person will no longer bother me. Or it's just such a broad term that I'm just curious, in your practice, kind of how you focus that for yourself.
Yeah, and I'm not a Greek scholar, but I think healing, it's the original meaning of the word is like bringing us back to wholeness.
Huh?
And to me that, again, it's reconnecting us with our true nature. And sometimes, right, I think it's a good point you make. There's a healing and that happens, and for whatever reason, the entirety of the problem doesn't resolve or go away. And that can be very challenging, but at another level, sometimes those quote unquote disabilities or problems or challenges, they're like the grist for the mill, or helps us polish ourselves in another way, that so it brings out something else better in us, even though we're carrying that. Because we're all going to have some kind of problem, and I used the example of Milton before. He was 88, he had some health problems, but like, he's 88. you know uh uh so we're gonna accumulate those things, and I think that's an important point, because healing isn't necessarily about problems going away or things that you don't like disappearing out of your life. Sometimes that happens, but to me, it's more about being in your true nature, and things functioning at least as optimally as they can on all levels of your being: physical, mental, emotional, spiritual, social, environmental. Um, and and when we stay with that, it's going to help all those other things mitigate, at least mitigate, if not disappear. So it's always going to be working in our favor in that sense. But right, there's not a correlation between what Western medicine would call curing and healing. I think those are not necessarily the same thing. Sometimes they are, but not necessarily. Because you can be cured of a medical problem, but you didn't deal with the issue, and then something else is going to come up later, which might even be worse. And people don't have that awareness.
Mhm. And so if you're dealing with your patients, how do you help them just, what's the question? How do you help them expand their awareness about that concept?
Yeah, that's a great question. So how do we help people expand their awareness of that? It's For me, it's just like wherever the door is, it's just gonna open in the conversation or on the table, and just paying attention to where that door, that window, or that opportunity is, and then bringing it more to their conscious awareness, whether it's, oh, it's interesting you said that, and it relates to this, or how's this feeling in your body? What are you noticing when we're moving your arm, or what are you noticing when we're tuning into your liver or this part of your lung, and then sometimes, let's say with a lung, it might be grief will come up, or and then the tears will flow. Or I also find freedom is a huge issue with lung problems. I see that as much as grief. It comes up all the time, and then when people see where they've limited themselves, or they've gotten caught in limiting situations, which may not be anything wrong with them, and then all of a sudden it restores their breath and their breathing, and something else happens. So again, it's like the opportunities are, I think they're here in every moment, and it's looking for them.
Wow. Well, I would like to talk a little bit more about that, and we're going to take a break and then move into our episode 2. In the meantime, I invite our audience to check out the podcast, both audio and on YouTube, and join us again for another episode of Mind of People, Portraits of the Pioneers. Thank you very much, Mark. Look to see you in the next episode. Be well.